I'm Franklin Becker. Join me on a culinary road trip as I take iconic state dishes from around the country and recreate them with a type 2 diabetes-friendly twist. This is 50 States, 50 Plates. Sweet tea, Alabama's water. There's nothing more refreshing on a hot summer's day. But a gallon of sweet tea can have up to 336 grams of sugar.
That's sweet.
Not if you're living with type 2 diabetes. For our sweet tea, we're gonna use a sugar substitute, monk fruit sweetener. That way, you'll still get that delicious taste. Start by pouring 2.5 cups of water over 5 tea bags. You're gonna cold steep it in the fridge overnight and remove the tea bags in the morning. Now add in your monk fruit sweetener and stir it until it's dissolved, about 1 minute. That's all it takes. Garnish it with lemon and mint, there you go. That's a type 2 diabetes-friendly drink anyone can enjoy. Now all I need is a lawn chair and some country music. Want more type 2 diabetes-friendly takes on iconic state dishes? Visit Ozempic.com.
Ozempic is an injectable prescription medicine used along with diet and exercise to improve blood sugar in adults with type 2 diabetes and to reduce the risk of major cardiovascular events such as heart attack, stroke, or death in adults with type 2 diabetes with known heart disease. Ozempic is not for people with type 1 diabetes or children under 18 years of age. It is not known if Ozempic can be used in people who have had pancreatitis. Do not share needles or Ozempic pen with others. Don't reuse needles. Sharing may lead to infection. Do not take Ozempic if you have a personal or family history of medullary thyroid cancer, multiple endocrine neoplasia syndrome type 2, or if you are allergic to Ozempic. Stop taking Ozempic and get medical help right away if you get a lump or swelling in your neck or an allergic reaction. Serious side effects may happen, including pancreatitis. Stop taking Ozempic and get medical help right away if you get severe stomach pain. Gallbladder problems may occur. Call your provider if you have symptoms such as stomach pain, fever, or yellowing of the skin or eyes. Tell your doctor if you have diabetic retinopathy or vision changes. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. Taking Ozempic with a sulfonylurea or insulin may increase the risk for low blood sugar. Talk to your doctor about how to prevent, recognize, and manage low and high blood sugar. Common side effects are nausea, vomiting, diarrhea, stomach pain, and constipation. Talk to your doctor about any side effect that bothers you or does not go away. Some side effects can lead to dehydration, which may worsen kidney problems. Drinking plenty of fluids may reduce your chances of dehydration. This video is not medical advice and does not replace the advice given to you by your healthcare provider. Talk to your healthcare provider about any concerns you may have about managing your type 2 diabetes. If you're not reaching your blood sugar goal, ask your healthcare provider if once-weekly Ozempic can help.